Welcome everyone. My name is Jessica Desardin. I am a program coordinator in the Office of Community Engagement. We are thrilled to be back for the September edition of the C Spotlight series. I'd like to begin with a statement from the Office of Community Engagement. We wish to acknowledge the Indigenous people who are past and present stewards of the land on which we pursue our just cause of improving health for all. Please note this session is being recorded, and please be sure you are muted throughout the presentation. We encourage everyone to use the chat bar to share comments or post questions for our guests at any time. This monthly series features community partners and the important work they are doing. We highlight their goals, motivations, and accomplishments, and the ways they have partnered with people and programs at MCW. Now, on behalf of our Senior Associate Dean for Community Engagement, Dr. Stacy Young, I have the honor to introduce today's featured guests who are here representing the Northeast Wisconsin Community Psychiatry Clinic, also known as the N.E.W Clinic. The N.E.W Community Psychiatry Clinic is a nonprofit clinic established in 2018 in association with the Medical College of Wisconsin, Green Bay, and the N.E.W Community Medical Clinic. The free clinic was founded with a mission to provide accessible mental health care to underserved and uninsured patients in the greater Green Bay area. Since opening, the clinic has grown into an important community resource committed to fostering healing, hope, and stability for individuals facing mental health challenges. Thank you, Ava, Chandler, Dr. Fulcher, and Dr. Maya for being our featured guests today. I would also like to welcome today's facilitator, Dr. James Billings. Dr. Billings is an attending psychiatrist at the N.E.W Clinic, director of the N.E.W Psychiatry Residency Program, and adjunct assistant professor at the Medical College of Wisconsin, Green Bay. Thank you, Dr. Billings, for being our facilitator today. I now turn it over to you.
Well, thank you so much. It's an absolute joy to be with you today and kind of hold this space together. I know we're meeting virtually, but one of the things that we're very passionate about in psychiatry is connection and building community. So I hope that you feel kind of held in a very encouraging space with us today. Please put any comments or information in the chat. I will be monitoring that. I don't promise that I will faithfully read what you put in there. I always keep the priority of spitting it in any way that I choose. So everybody else should probably monitor the chat as well, just to keep me honest. But thank you for joining us and kind of spending this part of your day with us. I'm going to get right into it and kind of start to introduce some of our guests and have them introduce themselves, because today is all about them. So first we have Ava Bray. Ava, can you just tell us a little bit about yourself, who you are, and where you are in your journey of becoming a physician?
Yeah, of course. So my name is Ava Bray. I'm a second-year medical student, and I'm actually starting my first rotation on surgery. You can tell by my scrubs. So I'm actually from the De Pere area, which is like right next to Green Bay. I've always been interested in pursuing psychiatry. So when I found out there was a free psych clinic I could volunteer at, I was very interested, and I'm really proud of the work we do there and very grateful to be a part of this great project.
So you're a medical student at the Medical College of Wisconsin in Green Bay in the second year doing surgery rotation. So we thank you for your surgery rotation, letting you have just a little bit of time to spotlight what we feel is a very important part of our community. And Dr. Maya, you are already a physician. Can you tell us a little bit about yourself, Dr. Maya, and where you are in your journey of becoming a psychiatrist?
Yeah, so I'm Dr. Maya. I'm originally from the Upper Peninsula of Michigan, kind of a rural area, north of Green Bay. So that's kind of how I ended up in this spot, as I get home. But I've really enjoyed working at the free clinic. Long term, I'm hoping to work at a federally qualified health center. So this has been really great training, as well as kind of getting used to treating these populations that we may not see in our clinic day to day.
Thank you so much, Dr. Maya. We also have another medical student with us, Chandler. Chandler, same thing. Could you kind of introduce yourself and tell us where you are in your journey of becoming a physician?
Yep. Hi, my name's Chandler, and I just started my third year of medical school. And I actually just wrapped up my rotation at the Wisconsin Resource Center, which is the prison in Oshkosh that provides mental health services to patients that need care there. So that was a very fulfilling and fascinating rotation to be on. And I started working at the free psych clinic in my first year. So I've been there a couple years now, and I've enjoyed the experience a lot.
Thank you so much. I appreciate that introduction. And then finally, we have Dr. Fulcher. Can you give the same thing, just a brief introduction of who you are, a little bit about yourself, and where you are in your journey of becoming a psychiatrist?
Hey everyone, Amy Fulcher here. I'm a fourth year resident right now, currently with the Northeastern Wisconsin program associated with Medical College of Wisconsin. I'm originally from St. Charles, Illinois, which is a suburb of Chicago. Met my partner and did undergrad in Wisconsin, and I went to medical school in Des Moines, but came back because I knew I wanted to be in Wisconsin, wanted to help patients who are underserved. I'm in a similar program as Dr. Maya, a national funded program that brings us to underserved places, basically helping people in need where most psychiatric care is needed. So really cool to start getting to get my feet wet in the free clinic while in training. So really cool opportunity and happy to be here.
Awesome. And very important question, Dr. Fulcher. How many horses do you connect with, and how many would you like to connect with in the future? Very important question.
Oh, well, you have to define how many. That's a tough one. I know I need a small herd in the future. So right now it's 2, but we'll see where that goes.
Small herd. That's what I like to hear. So obviously, as those of us who are in the mental health field, we are trying to build an amazing life for ourselves, for the patients that we're very privileged to be able to work with, and really try to affect the mental health care that's being provided in our region of the state of Wisconsin, whether that's the Fox Valley or the greater metropolitan Green Bay area and beyond. So we're very excited for all the work that's already been done to have a local medical school in the Medical College of Wisconsin, the Green Bay or De Pere campus, as well as having a psychiatric residency in the same neighborhood, so that we can train people in the local communities. And then, of course, hopefully they'll stay in and continue to invest in our local communities for years and decades to come. So thank you so much for being here. And I just want to start off in general. Perhaps, Chandler, you can address this. Can you tell us a little bit about what a morning is like at the Free Psych Clinic in Green Bay?
Yeah, so we are there the third Saturday of every month. Typically, we have a team of core students, which is comprised of 3 M1s, 3 M2s, and 3 M3s. And as many of us that can be there, we're there every third Saturday of the month. And we we have patients scheduled either through like the new clinic or from previous visits if they're there for a follow-up. We have about 10 patients scheduled, and we have students who are taking a course at MCW who can come and also volunteer with us. So our typical morning consists of whoever's on our schedule. Could be up to 10 patients who are there for mental health care. And so, yeah, we usually assign like an upperclassman with a lowerclassman to go and see each patient. And these interviews can take up to an hour as long as the patient needs. If it's like an intake, that can take up to a couple hours. And so we just really we talk to them like what they want to get out of coming here, and just address really any mental health concern that they're presenting to us with. And then after the initial interview, the upperclassman and a lowerclassman will go and talk with one of the residents like Amy or Dr. Maya. And then we'll go and talk to Dr. Billings, and then we'll come up with a plan together with the patient. So yeah, in summary, so we do that for each patient that we have that day.
Thank you so much. And when she mentions the core group of the medical students, they run the clinic. I want to be very clear. I certainly do not. I'm a very small part of it. This is very much a learner-led free psych clinic, and we're so thankful to have it in the Green Bay area. We partner with something that has a very similar name. So we kind of refer to ourselves as the Free Psych Clinic, but we partner with an amazing clinic called the N.E.W, or Northeastern Wisconsin Community Clinic. And if you were to walk into the facility, which is a beautiful new facility, on one side they have mental health, on another side they have their physical health. They have other partners as well, including physical therapy and dentist work. And they allow us to use their space, like Chandler was saying, on the third Saturday of every month to offer, in addition to the services they provide, an absolutely free clinic for members of the community. So Dr. Fulcher, can you tell us just a little bit about your role as a resident physician and what the morning looks like for you?
Yeah, so typically I get to come into the free clinic and I get to sit down and talk with some students. They do a really excellent history in talking to the patient and oftentimes helping the patient express some of their concerns, which are often quite detailed and challenging. And usually we use an interpreter service. So, we're really gaining some skills in how to meet the patient where they're at. After we discuss as a team, me talking with the medical students about so far what the information they've gathered and their thoughts on what the patient's concerns are and what the patient needs, we formulate a plan together. And that's when I get the opportunity to step in to ask a few more clarifying questions with the patient. And then we get to all discuss as a team with Dr. Billings at times, and then getting to finalize that plan with the patient. So really fun to hear the different perspectives that medical students bring to the table. I think each of them have different past experiences from past rotations. Some of them have really excellent knowledge on maybe what they would recommend or what they would think to do next. So it's really, really great getting to do some teaching, some learning, and just getting to all work together. So really rewarding.
Thank you so much, Dr. Fulcher. And Ava, is this medical students that are all going into psychiatry that volunteer at the clinic, or what kind of medical students are choosing to engage in this free psych clinic?
So I would say it's a good mix. A lot of the people that choose to volunteer at this clinic, they just want to become well versed in psychiatric care, because psychiatric care, even if you're not major or choosing psychiatry as your specialty, you'll still see that come up in other types of care, especially with a lot of our classmates wanting to go into family medicine. Um, I think it's an invaluable experience for them to get to come to a psychiatric clinic and be able to apply that to their future careers.
Absolutely. Whenever I train learners, I say, it doesn't matter if you're going into psychiatry or not, our patients are everywhere. So you get to take care of them. And we'd really like our learners to become confident, just like Ava was saying, in taking a thorough history, understanding different components of the mental status exam, diagnosing, and then triaging, right? What types of things can be cared for in other settings, and when should you really refer to a psychiatrist for that specialized care? Dr. Maya, any thoughts that you have on the clinic and what you're learning about providing care in a community setting? Either things that are encouraging you, inspiring you, or things that you feel that, as a community, we just need and need more of.
I'd say one thing I always find kind of inspiring is the patients really do engage and continue to come back time after time. Our rate of follow-up is actually fairly good, especially for a free clinic, because a lot of times you see in other communities maybe high dropout rates, stuff like that. So I'm just really impressed with our patients and their resilience. Overall, I think it has raised my awareness, because we do have a high Hispanic population, of just the need for physicians in general that speak Spanish to deliver care, and also like the training of interpreter services, because especially when I started using an interpreter in the beginning, I don't know if I was very skilled at it, and I still continue to try to improve that to this day, because it's kind of an art to learn how to use an interpreter to take a psychiatric history, especially if there is any cultural barriers or stigma, that kind of stuff. So that'd be one thing I guess I've taken a big takeaway.
Thank you. And if you think about our goal of providing amazing personalized care to all the members in our community, in an area such as mental health, where sometimes the differences are such a fine line between something that might be a worrisome thought or something in the direction of anxiety versus a delusional thought and something that might be suggestive of psychosis, we really need phenomenal, highly trained medical experts doing the translation for us into different languages. So Chandler, I'm wondering, how does that process work? I know we don't yet have that in-person live human in the room who's an exceptional translator, but what do we do at the free clinic to provide medical care in the language the person feels most comfortable talking about their mental health? What's our process? What do we do?
Yeah, so we have a translation we have a subscription to a online translation service. So we have like an iPad set up on a little stand, so we can see the translator face to face. And so they join the room with they join us from the beginning of the visit, from like when we check in the patient all the way till when we check out the patient. That translator is with us on the iPad. That helps us translate every part of the encounter.
Mhm. And when you think about communities coming together to build something that's amazing, it takes different partners with different skills and a lot of generosity. We don't meet in our own space as the free clinic. We meet on the site of the N.E.W. community clinic, and they allow us to use the site for free. We use all of their equipment, their meeting rooms. We use a translation service. And not just that, but we need access to some type of medical record. And we happen to have an amazing partner in one of our local providers in the area, Amplify by Bell and Health, and they help us with the electronic charting, giving us access to their version of Epic. So when you think about what it takes just to set up and continue to run a free clinic, at least from our perspective, we have a medical school involved, and we have a residency involved, and we have a major regional partner in Amplify by Bell and Health being involved, and the N.E.W. community clinic being involved, and really the entire state being involved because of the ways that our legislators have made mental health a priority in how they allocate our state funds and our budget. And so the medical school and the residency and other things are getting funds because people in Wisconsin are saying our mental health is important. And as we think about equitable care and caring for the whole community, we're excited to be able to bring this free clinic into the area, and to be able to say, no matter what you make, no matter what your job is, no matter your income at this moment in time, we'd love for you to be able to receive high quality care. So I'm going to throw this next question out to the whole group and maybe have 2 or 3 people answer, but what are you learning about yourself as you're spending time with the free clinic and taking care of patients in this unique setting?
I'll just like chime in just for a little bit. One little thing that I've learned about myself is just the impact it can have just listening to someone. And I just wanted to go off, I think it was something Dr. Billings brought up, or Dr. Maya. Our rate of follow-up is pretty good. And so it's very exciting to see someone who continually, makes follow-up appointments and comes back for those follow-up appointments. And sometimes what some of those patients just need or just want is to talk to someone and have someone listen. So I think the power of listening is something that I've picked up on.
Absolutely. Thank you, Chandler.
I think something that our patients have shared with us on multiple occasions is similarly to what Chandler said, just how appreciative they are to be receiving the care that they are. It's oftentimes a more prolonged process to have our patients sit down with us because they see a couple of medical students, then they see the resident, and then at some time they might or may not see the overseeing doctor, the attending doctor. And so it is a little bit of a time, a long time that they're with us. And, we know that of course they have things in their lives, but they come back because they say, we're receiving good care. We appreciate the time, we appreciate the care, we appreciate the recommendations. And, I think especially from learners' perspectives, right? To feel that you are making an impact, that you are not only learning about people and how to help them in your career, but really doing real good for people. That makes it worth it.
Thank you, Dr. Fulcher. I appreciate that. Anybody else? I can go on to another question, but I'll give just a moment of pause in case you've been thinking of something and are ready to answer.
I guess I just have one thing. I will say another thing, I started the clinic my first year of residency shortly after graduating medical school. And it was definitely a big role switch, jumping from the medical school, student perspective to the resident teaching perspective. So I think this clinic also provides opportunity for residents to kind of go through their teaching styles as well, and kind of learning how to train medical students, because we need physicians to train residents, which is Dr. Billing does a lovely job, and we need residents to train medical students. And so keeping up that kind of educational continuum, it fills that gap as well in our community.
Thank you, Dr. Maya. So my next question is for the audience. And so if you could answer in the chat, I'd love to get at least 5 responses. And guests, you're not allowed to respond. So you just sit back and enjoy this time. But one of the things that I really appreciate about working in the free clinic is being reminded of why I went into medicine and why I went into mental health. So I'm curious, for those who are in the chat, could you drop just a sentence or two about what you do in your job in the community, and why did you go into that, and what drew you into that? And of course, I'm not asking for several paragraphs, but just a little bit of a taste. So as a community, we can kind of better understand of what is driving us and what is motivating us to provide care in this space. And kind of giving some time for the audience to type in their responses. I think that working in the free clinic connects me to people who are in need and who want to get better. And so it excites me to think that, this free clinic, we only operate, again, a half Saturday a month, but it is on a Saturday when the work week, Monday through Friday, maybe, things, people can't get away. So we get to provide that on a Saturday morning, but we get to meet people where they're at and try to help them build a great life. And when I think about the big purpose of psychiatry, we're trying to find ways to help people live authentic lives, connect with deeper meaning in who they are, what they believe most, and find any areas where they might be stumbling or struggling, and walk with them so that they can really feel as though they're living the life that they're here to live, and contributing to the people that they love in a meaningful and a wonderful way. So working at the free clinic in my role as an attending, I get very excited by the residents, by the passion of the medical students, and inspired by the patients who are seeking kind of to have that American dream, right? Of building a life that is full of opportunity and hope, and being able to care about their loved ones, and being able to do so from a place where, with regard to their mental health, they're doing well. So for us to have a small part of that excites me. Before I go back to our guests, I'm just going to highlight a couple things from the comments. And remember, I do not promise 100% accuracy. So we said someone wanted to work for a nonprofit, and in there we're kind of giving grants to people and organizations who want to improve the lives of others, is how they're contributing. And what a great way to connect some of the most important things that we need to connect in America, right? Money and passion, and people willing to kind of put the time in and use that money responsibly and effectively and with compassion and love. Scrolling down, someone works in community engagement to help make connections. One of the most important things for our mental health, right? Our connections, provide education, and ultimately make a big impact. Absolutely. And then another said, as a clinical research coordinator working in cancer clinical trials, they were taught to help others from a young age. So very deep purpose of helping others as a part of who they are, and doing this job does that in cancer clinical trials. Also, this person says loves connecting to patients, treating them like a person, and knowing them more than just a patient. And so if you think about what exceptional healthcare would look like, the absolute goal, this would be about us kind of declaring to the world what a doctor is, what a physician, a nurse, administrator, what we do in our field to make this world a better place. And mostly it's about caring for people. Another person wrote, they work in the School of Medicine, the Office of Admissions. Love being able to help folks like Ava and Chandler navigate the application process on their journey of becoming a medical student, and then as they become a medical student, becoming a physician. And then one more, and then I'll turn it back to our guests. I work for the Wisconsin Child Psychiatry Consultation Program. We can reach more children through their PCPs by their primary care providers or physicians, leveraging strengths of the Medical College of Wisconsin and community partners. And so if you think of our state as being a huge area with 72 different counties and people working all throughout the state, some of us who work in mental health can feel very isolated. And events like this and the Office of Community Engagement is intentionally working to connect, right? To connect people that share a similar passion, that love healthcare most of the time, and want to make a difference. And so it's exciting to see. Thank you for those of you who took time to put some things in the chat and kind of partner with us in this way. So back to our guests. I always like to talk about something negative when I talk about healthcare, because this is an internal part, right? And we can't just talk about the positive. I think we need to talk about, in a professional way, the negatives. So tell me something that's difficult that you are learning to either work through or learning to become stronger in when it comes to healthcare. Because I think that part of being a great physician or other member of our interdisciplinary team is enjoying the good times and then understanding the difficult ones. So I'm curious, from medical student to resident, and then all answers attending to, what's hard in healthcare these days? What are you or your classmates or those that you care about, what are they struggling with in healthcare?
Kind of going off what we were talking about earlier with the translation services, I feel like, and this has not just happened at the N.E.W. Psych Clinic, throughout my rotations, I've noticed that sometimes translators will have biased remarks to the patient. You can tell that sometimes they'll be having a conversation occurring, or you can tell the translator is like putting judgment onto the patient, and that's been a little bit difficult to navigate at times. I found that just asking the translator, like, I'm just asking you to translate, not for your opinion on the situation kind of thing, is helpful, but it's difficult because with our current state, we are a little bit limited on translation services and being able to, if we can't understand the language, we don't always know what's going on and what's being said, or if it's being communicated effectively. So I feel like that's a current struggle that would be nice if we were able to develop a solution for eventually.
Oh, thank you for that, Ava. So we have a medical student interacting with a very different member of the interdisciplinary team, right? A translator who might translate for every single area of healthcare. And when it comes to mental health, there's still plenty of stigma left in all of the major societies of the world when it comes to healthcare. So that stigma and that struggle to understand the place of mental health care in our translator population can also be affecting patient care. Thank you so much for that. That's a great example. What are the things are struggles and difficult, and you can drop this in the chat as well if you are kind of in our listening audience, but I like for us to talk among ourselves about the hard stuff.
One of the things for me that I realized is that there isn't a quick fix when it comes to providing mental health care. Some of our patients, they face lots of very complex barriers. They come from lots of different backgrounds. A lot of them have experienced different forms of trauma, and that there's like no quick, easy fix for some of those mental health issues that they come with. And so I think that's been something that I've like almost constantly struggled with is, I wish there was just like a quick, like a pill or something like a Band-Aid, something quick and easy that we could do to help. But yeah, that's one thing that I've like picked up on and come to realize.
Yeah, some of these situations that we find ourselves in and those we love in are very difficult, and they're complicated, and it's 7 or 8 different things, and there might be a pill for part of it that'll help to a degree, but it's involves their whole life, and so not a quick fix. Doesn't mean that amazing progress can't be done, but that overwhelming sense of, oh my goodness, how do we help? Sometimes I envy my internal medicine colleagues who work on blood pressure. Like, boy, some days trying to treat blood pressure sounds like a dream. Most days not, but some days. Anything else that any of our guests find just difficult to deal with in healthcare right now in 2025?
You wouldn't expect it. You would think, technology surely is a huge help, and it is in a lot of ways, but it can also really hinder us. I think we're in the business of people and trying to get to know people and hear their stories. And so sometimes we need documentation and, systems that help us remember certain details about patients that can continue on as we continue to get to know them and to see them. And so, I know Amplify has gone through a recent merger. And so there's been some logistical challenges with that there's some technological changes that happen. And then sometimes we need to reach out to support, whether it be an IT help desk or somebody who might help us work through a computer issue. So at times that can be really challenging for us because we're really just trying to focus on what matters. And that's the people and the time and the compassion and the connection. And then we get stuck with some of those other challenges too, just, logistically. So.
Yep, absolutely. Thank you, Dr. Fulcher. Anything else kind of on the difficult side of things before we move on? Nope. Okay, good. So I wanted to talk a little bit about the history of the free clinic because I am a more recent addition and I'm really representing as a facilitator 8 years of history that have gone into establishing this free clinic and then maintaining it from then until now. And it began about 8 years ago when the Northeastern Wisconsin Psychiatry Residency opened in Green Bay. And the very first class of residents arrived in town. And one of them, Dr. Brooke Mastrioni, wanted to engage her community and give back and fill a need for people to be able to get psychiatric care no matter if they had or didn't have insurance or had or didn't have the money to pay. And so she proposed the idea of starting a free clinic with others. And her, along with Dr. Robert Guthrow, who was at the time the program director of the Northeastern Wisconsin Psychiatry Residency, teamed together, and other members who work at the Medical College of Wisconsin, and specifically Medical College of Wisconsin Green Bay site and location, started working together 8 years ago to start a free clinic. And Dr. Guthrow then became the first attending psychiatrist to volunteer his time on Saturdays while he was a program director in Green Bay. And then he took a job in Wausau, about 90 minutes away, and for the next 5 years continued to be the sole attending psychiatrist, helping this clinic to function, and would commute and continue to do it. And so I really only came on the scene in the last few months and took over from Dr. Guthrow and the great work that he and a whole team of people kind of set in motion years and years ago. The exciting part for me was I was a resident in the Northeastern Wisconsin Psychiatry Residency where Amy and Maya are doing their training. And I was in my year, I was the second class of residents. And so I got to watch as Dr. Mastrioni and Dr. Guthrow and other partners put this free clinic together. And I got to be a part of it as a resident. And so now being a part of it as an attending psychiatrist is an absolute delight. To be able to kind of just see how community partners working together and really sacrificing to make something great for the community, not just get off the ground, but run for the last 7 to 8 years. So I did reach out to Dr. Guthrow to invite him to be here today. He wasn't able to, but I wanted to kind of make sure that we highlighted some great work done by himself and then Dr. Brooke Mastrioni as kind of the inaugural psychiatrists who got this program up and running. So back to our panel. Let's open it up at this time. We're quickly running out of time. So anything else that you just like to talk about the free clinic, whether it's a specific patient encounter that you've had that has been encouraging to you. Of course, we'll leave off any names or make up a fake name for the patient, but what can you tell us to help the people who are here today understand the free clinic just a little bit better?
I guess I can go. I think one patient that comes to mind is somebody we saw earlier this summer, while I was working with two of our medical students, and the patient had relatively complicated medical history as far as, there's some medical things going on, as well as a back psychosocial history was kind of complicated as well. We were kind of trying to figure out, like what exactly is going on here, right? As far as like, do we need to be more therapy minded? Do we need medication? So we're there sitting there talking with him, and, we started asking more questions about his background, right? Like, where did you grow up? What was that like? Really exploring that biopsychosocial, and, it kind of came out for him being like, these are some things that I've like never told anybody before. And I've never disclosed these things, and like, I feel really comfortable with you guys. And so that was really, quite an honor to sit with that, but it was also cool to have the medical students maybe experience that for the first time, especially around things that are so sensitive. Because it's, it's kind of a unique experience, and learning how to like sit with people during those uncomfortable times. Or manage like, also your own emotions. So like afterwards, the patient left and got to talk about transference and what that means, and, how you feel and how the patients make you feel, and then how the patients feel about you, and how to be mindful about that in the room too, when we're dealing with, sensitive topics. So I thought that was kind of a cool opportunity that you don't always get.
That made me think of a patient too that when I was in my first year and I first started volunteering, really had an impact on me, where she initially began visiting the clinic after her husband of 40, 45 some years had passed away, and she was really struggling dealing with his passing. And so she had multiple visits with us, and slowly we started to see her progress, where she began to become involved in things she loved again, like gardening was one of the things she really liked. But her story kind of stuck with me just because it it just gives me like a sense of, okay, the work that we're doing can be very impactful for someone, because she was able to get back part of her life again. With assistance and medication, and coming to the clinic and receiving the help that we've had in our sessions, or that we've been able to provide in our sessions.
Thank you, Chandler. I appreciate that. I have two little things that I'd like to share, and then I'll open it back up in case there's one more. But one of my favorite things is when we ask the patient when they'd like to come back, and they say, I'm doing great. Can I come back in 6 months? And so we just had that, because most of our patients, if they're still struggling, they ask to come back the next month. And so again, I take zero credit for this. But what the medical students and the residents and Dr. Guthrie were able to do is, personalize this person's care and get to them to a point where they felt like their mental health was well controlled, and they could get back to focusing all their emotional energy on their life and their loved ones instead of just getting better. So that was a great one. And then we mentioned sometimes in the psychiatric world, the patients are very complex and the situations are very complex. So I do think about a woman who came in, and several different things going on, but she really came in because of a work injury. And so you think about, kind of our core values in this country, and being able to build a great life and kind of try to be a land of opportunity. And here was someone who was at work, and I believe was injured on the job, and got hurt, and now has pain, and I believe doesn't work there anymore, or they're impacted every day with their pain and how much they can work, and they didn't qualify for workers' comp. And you could just imagine how this life event could affect someone's mental health. And so thinking about trying to help another person as they're going through several different things together, that's what we love, those of us who go into psychiatric care and into therapy and counseling, kind of this realm of healthcare. So if you practice in another area or are contributing to kind of medicine in general, as you're caring for patients or working with a medical school, think about what the role of psychiatry is, because we also love to be consulted on your difficult cases. So you might be working as a cancer researcher and doing clinical trials, and might have a patient that's not only going through cancer, but perhaps something else. And there may be a time where you say, let's get psychiatry involved, because sometimes our patients won't come and see us in psychiatry unless one of their other doctors opens the door. And so whatever your role is in healthcare, I hope that you would trust what we in psychiatry are doing, and would at times allow us to care for your patients in an area that we're very passionate about. All right, so I'm curious about the atmosphere among the medical students on a Saturday clinic. Is it fun for you guys to be together in that setting? What's it like when you guys are there together?
Yeah, no, it's definitely a fun time when we're all, especially when all of us, like a group of us, is there together, in between patients, getting to just enjoy our Saturday together, knowing we're doing something beneficial for the community, and even learning on our Saturdays. We're learning about the patients, learning how to treat different disorders. So yeah, it's a very unique and rewarding experience.
And I just want to put a plug in. One of the things I love the best about being a physician is my colleagues. Being able to work with other attendings from every field of medicine, work with residents, work with medical students, to be able to spend a good percentage of my professional life hanging out with and doing work in the healthcare sector from great people who want to help people and who are smart. That really is such a wonderful blessing for me and working as an attending psychiatrist. All right, we're entering into kind of the last stretch of our time together. I'm curious for Dr. Fulcher or Dr. Maya, you guys are resident physicians. Can you tell us just a little bit about what residency training is like, and then what happens after residency? Because sometimes we don't understand, very well. There's medical school, and then you become a doctor, and then something happens, and then you're a doctor, and then board certified. Tell us a little bit about residency and what psychiatric residency is like.
I'm a little farther along than Maya, so I'll go ahead and take this question. Yeah, so basically we go through medical school, and at the end of medical school, or leading up to the last year of medical school, is when we start putting in applications for residency. And at that point, we decide one or maybe a few different specialties that we might be interested in based on the rotations we did in medical school, and we decide what we want to do for our career. So Maya and I decided we were really passionate about helping people with their mental health, and psychiatry was the avenue for us. So we put those applications in and were accepted into the Northeastern Wisconsin psychiatry program. We start and, it's a slow buildup of learning to become that provider, to become that doctor, and learning how we can best support our patients. We learn skills along the way over the course of our 4 years. Typically, as a first year, there's a variety of different types of rotations that we do as a first year, kind of getting that general medical education rounded out and completed in our exams, and then really starting to find ourselves in our psychiatry and in our knowledge about psychiatry medicine and how to care for psychiatric patients. Our second year is an outpatient-based treatment year where we have our own clinic at the VA, and we learn about ourselves and how we can longitudinally see patients over time. We start to pick up psychotherapy treatments and learning how to walk with our patients in that way. Third year, a little bit more specialty type psychiatry. We get some time in forensics. We get some time in alcohol and other drugs. We get various other inpatient exposures to more severe psychiatric mental health. And then finally, our fourth year, the year I'm in, we get to decide, hey, what do I want to do for the rest of my life? And maybe start to apply to some jobs, consider if we want to go on to a fellowship or an additional year or two of training. And yeah, I think that kind of sums up all that we do in residency.
Thank you, Dr. Fulcher. Dr. Maya, can you take us through to some of the very straightforward issues or problems that we might see in the free clinic, whether it's symptoms or diagnoses? What are we taking care of here?
Sure. So in the free clinic, we do see a variety of things. kind of going from one spectrum to the other, right? Sometimes we see things more like major depressive episodes, especially if somebody's struggling through a particularly hard time. We see a lot of anxiety. There's also occasionally you see maybe something more on the serious side of like serious mental illness, as far as like an occasional bipolar or schizophrenia. It's not as common. But most of the time we're trying to take care of some of the personalities too, right? Like people who have kind of chronic mental health relation to their attachment styles and relationships and how they kind of function in the world. But sometimes we're doing medication management. Sometimes it's also just like supportive counseling, being like, you know, you are going through a tough time and that makes sense why you feel this way. It's not easy. And so offering people reassurance as well. And then I think there's other referrals we can do to community resources as well. We always try to look if somebody has a community need. We try to connect them with that as well to the best of our ability.
Thank you, Dr. Maya. Appreciate that. And then I'm going to go kind of one by one. We'll start with Ava and Chandler, and then Maya, and then Amy. Anything else you'd like to say as we're kind of wrapping up this time, either about medical education, what you're learning, or the free clinic? Anything else you just like our community to know, starting with Ava?
Honestly, I think it's important just to know that like this is a resource available. When I was asking my preceptor today if it was okay if I took an hour to be with you guys today, he had no idea this was a thing. And he was like, "What? We have one of those?" So I just wish more people were aware of it. So if you live in the Green Bay area and you know people that would be interested in our program, just spreading the word I think would be amazing.
Absolutely. Thank you, Ava. And I Googled Northeastern Wisconsin Free Psychiatry Clinic last night because I was curious what came up. Nothing came up. Nothing came up. So we probably need, thinking about some of our needs, people to, get the word out a little better with our community. But it's also tricky because we partner with the N.E.W. Community Clinic. And when you do a Google search, that does come up. And so really, as Ava's saying, there are two resources we'd like you all to know about. There's the Monday through Friday N.E.W. Community Clinic, which does take insurance. And I believe that even if they don't have insurance, they try to work with people as best they can or get them insurance. And then there's our free psych clinic that works a half Saturday a month in the Green Bay area out of the same clinic. So just want you to know about these resources in the area. We are here and we're excited to be here. Chandler, any kind of wrapping up thoughts or other things you just want our community to know?
Yeah, no, just piggybacking off of that, because there have been a couple of Saturdays, not recently, but in the beginning where there weren't a lot of patients. And so just getting the word out, getting people to be aware of our service, even physicians, because we even treat, just building off of what Dr. Maya was saying, some of the patients we also see have things like OCD or insomnia. And sometimes patients don't even realize that that is an issue, and that they could get treatment if they needed that. And so yeah, even if physicians were more aware of the services that we can provide, and yeah, just getting the word out, making people aware of us, I think would be huge.
Absolutely. And since we're a free clinic, we will work with anyone. If someone comes and they do have insurance, sometimes we refer them to the main clinic. And then if they don't, we'll take them on a Saturday. But sometimes if they can't make it to a clinic appointment Monday through Friday, then we'll see them on Saturday just to help. And the best way to refer someone to the N.E.W. free clinic is just to call the N.E.W. Community Clinic. And they are our partner. We could not exist without them, and they help us with scheduling. Because again, everyone that's here today, we're all volunteers. We're doing this in addition to the work that we're doing, whether that's training to become a doctor or a doctor training to become a resident or a crazy attending physician. So we would appreciate kind of getting the word out. Dr. Maya, anything else you'd like to know as we're kind of wrapping up today?
I guess one last thing that comes to mind is really, I feel like a lot of our patients sometimes come in and say like, you know, I feel like I don't have a sense of community here. I feel like I'm kind of floating. I have no one. And so I think this clinic does a really good job of both connecting them to us and the community, right? It is another resource for them. It makes people not alone, which is kind of the beginning of community. And then it also helps our medical students and our residents and our attendings not be in professional silos. So it's building community within the education, but also for our patients as well who might be struggling with that.
Absolutely. Thank you, Maya. Anything else, Amy, for today?
I think the very last thing I wanted to say was just thank you to everybody here. Of course, everybody on the panel, appreciate all of you and look forward to seeing you next free clinic. But everybody involved with MCW here on the video, I think what I felt recently while at the free clinic was just how lucky we are to be there, and all the resources, everything that comes together and culminates into this opportunity for these patients. I had a medical student with me this past Saturday, and he said, yeah, I saw this patient when I was a first year, and here I am a fourth year, and he is doing so much better. And I get to see that. I get to see what we did and the care that we provided and how we could be there for this person. And I'm going to take this with me. So it really means a lot to every single one of us, and to the patients as well. So thank you all for your contributions.
Absolutely. I'd like to echo that thank you as well. And I have one last thought, and then we're going to bring up another slide about the next installment, next months of the community engagement. But the one thing that I would encourage is that if you yourself are on this call, part of this call, and you or someone you love is struggling, sometimes it's just wonderfully helpful to reach out to someone in the mental health world. A lot of my patients don't want to go to a partner or a friend or a parent or someone else that they know in their social circles to talk about things. And that's why we exist. So we would love to support you, whether you're on the call or someone in the community that could use some support. You can find us in a lot of different ways, reaching out to the N.E.W. Community Clinic, reaching out to the Northeastern Wisconsin Psychiatry Residency, or just reaching out to some of the numbers that are available to the greater MCW community. We love connecting people to the help that really will, give them that extra support they need to build a great life. So why don't we bring up that last slide, if it's okay? We'll kind of start to wrap things up, and I'll kind of just announce our next meeting, which will be the month of October already. September is one of my favorite months, so I can't believe how quickly the fall goes by. But we'd love for you to join us again at our next month's meeting. And we're going to throw the date up there on the screen in just a moment. But thanks for joining. Thanks for taking time out of your day to be here with us. And if you'd like to partner us in any way, sometimes doing these community engagement events causes people to think of new ways that we can collaborate together. So if over the next day or two that's sparked, I'm going to drop my email in the chat. You can always shoot me an email directly. I would love to either talk to you myself about how we could collaborate, or help you find the best person to expand what we're doing. So next month it'll be October 29th, same time period, kind of the lunch hour, 12 o'clock. And we promise we will get details about who's going to be presenting and what that's going to be shortly. So thank you so much for taking time out of your day. Thank you to our panel for being here with us today. And I just hope that you'll have a great rest of your day and that you'll be encouraged in the work that you do, wherever that is. Thank you so much, and take care. Bye-bye.